Mr. Thompson is a 17-year-old male patient admitted to the hospital for pneumonia. He has a history of chronic obstructive pulmonary disease and hypertension. He is currently in a shared room and has been experiencing increased anxiety and discomfort during his stay.
You're in a hospital. People here will help you with your health.
Pero dito, hindi ako makatulog dahil sa ingay. Kaya isama mo na ako.
As the observer, here are my notes based on the written questions.
Uwi mo na. Huwag ka nang maga.
Isama mo na ako. Ayoko na magtagal dito.
You still can't pa. Kailangan ko magpagaling.
Pero mas lalo ako hindi gagaling if I stay in a longer here in this room.
You're in a hospital. People will help you improve your condition. So rest assured, nagkagaling ka. But for now, dito ka muna magpahinga.
No one's getting any better in this room. I mean, look at this. Ang alikabok. Paano ako gagaling yan? Mas lumala pa ata yung ubo ko dito eh. And the patient next to me, she and her family are quite noisy. Alam mo, mahilig ako matulog ng hapon. Pero dito, hindi ako makatulog dahil sa ingay. Kaya isama mo na ako.
I'm sorry pa, pero hindi talaga pwede. We still need your doctor's approval about your medical condition. Don't worry. I'll go to the desk and ask some nurse about your concerns. But for now, magpahinga ka muna.
Fine.
Okay. Sige pa. I'll be on my way. Excuse me. Hi, nurse. Can I talk to you just for a minute? Yes, ma'am. How can I help you? Well, you see, I'm the daughter of one of the patients in room 203, Mr. Thompson, and he told me that he's quite uncomfortable with the room he's in now. Oh, I see. Could you tell me exactly what the problem is? Well, the room is quite dusty, and I've observed that his cough is not getting any better. And that's concerning since he has pneumonia and has a history of COPD. And the patient is sharing the room now is quite noisy, making my father unrelaxed and uncomfortable.
I understand, ma'am. Thank you for bringing this to my attention. I will go to your father's room to assess personally the situation and make sure that your father will have a comfortable stay here in the hospital.
Thank you.
Good morning, Mr. Thompson. Your daughter has already informed me about your current situation, and I am here to further assess to know how I will address your problem. I will be asking you a few questions, and I want to assure you that everything that you will share will become confidential. Shall we begin, sir?
Finally, someone will take action about this situation. Make it quick.
Okay, first let's talk about the noise level. How are you finding the noise inside your room? Is it quite comfortable for you to rest, or is it too loud?
Quiet? Nagbibiro ka ata. The patient next to me are too noisy. And yung pinto, sira. Hindi masara ng maayos. Kaya yung ingay sa labas, rinig na rinig dito. Could you please fix it or ilipat nyo lang ako ng room?
I understand your frustration, sir. While waiting for your room to be fixed, I will ask the maintenance to fix the door and also talk to the patient here to limit their noises. And also, I have noticed that the light here is quite bright. Is it comfortable for you, sir?
No, the lights are too bright. Ang sakit sa mata. And yung sunlight, halos wala pumapasok sa room na to.
In regards to that po, I will adjust your curtain to allow more natural light to pass through and also ask the maintenance to change the light bulb into softer light. Now regarding cleanliness po, your daughter have mentioned about the dust, and I have also observed that the floor here hasn't been mopped recently. Have you noticed any discomfort because of the dust?
Yes, this room is so dusty. I have pneumonia, so please take care of it immediately. Siguro gumamit kayo ng mop, imbis na duster na kinakalat lang yung dust. And yung floor, wala ba kayong personal na naka-assign dyan, nurse? Parang palengke sa dumi.
I am very sorry, sir. I will notify the cleaners immediately to clean the room, and I will tell them to use wet mop to prevent the dust from spreading. How about the ventilation and temperature po? Are you comfortable with the room temperature? How does it feel to you?
Ay, sa umaga, sobrang init. Sa gabi naman, sobrang lamig. Balik ko ata utak ng AC sa room na to eh. Maybe appoint someone na mag-check ng temperature sa room na to.
I will ask the maintenance to check the air condition right away, and while waiting for it to be checked, I will monitor the room temperature from time to time to make sure that it's comfortable for you, sir. Sir, how about the comfort in your bed and chairs? Does it feel comfortable for you?
No, my bed are too high for me, nurse. At yung upuan na to, kapag ginagamit ko, sobrang ingay.
I understand, sir. I can lower your bed to adjust to your height, and also I will do my best to find a replacement for the chair to make it more comfortable for you and avoid the noise. Lastly po, since you are sharing room with the other patient, do you feel comfortable and having enough privacy when conversing about your health?
Sa totoo lang, hindi. I feel exposed and I don't really like talking about my health concerns when someone else in this room.
I understand your concern about privacy, especially when discussing your health. I'll ensure that a privacy screen or curtain is placed around your bed to give you more confidentiality. And I'll discuss this issue with the staff to ensure that you have your privacy when talking about your health concern.
Thank you.
I'll make sure these suggestions and changes are implemented immediately while waiting for you to be transferred in your requested room. After you got transferred po in your requested room, I will also do the things that I have done here to make sure that you will have a comfortable stay in your new room.
We will look forward for the improvements. Nurse, thank you again.
How about now, sir? Is the temperature and lighting much better?
Yes, much better.
I'll be off now, sir. If you have any concern, just call me at the nurse station.
As I observe, the nurse is attentive and shows empathy while addressing Mr. Thompson's concerns. She listened carefully to his complaints, showing respect for his feelings about the room's conditions. As the observer, here are my notes based on the debriefing questions. So for the first question, what specific environmental changes did the nurse suggest? Let's start with the noise level. The nurse proposed implementing noise reduction strategies and requested that staff and patients maintain a lower volume. She also considered the possibility of moving Mr. Thompson to a quieter room. And for the lighting, she suggested replacing the harsh fluorescent bulbs with softer lights and adjusting the curtains to allow more natural light into the room. And for the cleanliness, the nurse informed the cleaning staff to use a wet mop to prevent dust from aggravating Mr. Thompson's respiratory issues. And for the ventilation and temperature, she planned to have maintenance check the air conditioning unit to stabilize the temperature. And for the last one is the privacy. The nurse acknowledged Mr. Thompson's need for privacy and proposed placing a screen or curtain around his bed to ensure confidentiality during conversations about his health. For the next question, how did the proposed changes align with Nightingale's principles? The changes reflect Nightingale's emphasis on a clean, quiet, and well-ventilated environment to promote healing. Adjusting lighting and reducing noise supports comfort and relaxation, which is crucial for recovery. For the third question, in what ways did the environmental factors impact Mr. Thompson's anxiety and comfort level? The noisy environment, poor lighting, and dusty conditions contributed to Mr. Thompson's anxiety and discomfort. His inability to sleep and relax due to these factors aggravates his respiratory condition, making him feel unwell and anxious. For the last question, how can the nurse advocate for the patient's needs in a hospital setting? So the nurse can advocate by actively listening to patient concerns and making necessary adjustments to their environment, and also collaborating with other staff members to implement these changes. She can also ensure that patients' needs and comfort are prioritized during their stay. And overall, the nurse's responses were thoughtful and aligned with Florence Nightingale's principles as they focus on creating a quiet, clean, and comfortable environment for Mr. Thompson. By addressing these environmental factors, the nurse showed advocacy for the patient's needs and prioritized his well-being.